My name's Paul Haslam. I'm a consultant orthopaedic surgeon specialising in knee surgery at Doncaster Park Hill Hospital. I've been a consultant now for over 10 years, and during that time I've developed a lot of experience of treating all manner of knee conditions. Now, many of my patients present having had a knee injury, and they may have heard a snap or a pop and the knee swelled immediately afterwards. This could be during a simple trip or fall, or playing sport, or on a skiing holiday with their friends. They may have been seen by another doctor who may have underestimated the severity of the injury. Often you attend the accident emergency department, have an x-ray, the x-ray is normal, and you're falsely reassured about your knee. If the knee is still painful and you have had a significant injury, I would recommend that you see your local knee specialist or be referred to an acute knee injury clinic, as there may be a significant knee injury here that's been misdiagnosed. This is a model of a right knee, and as you can see, it's a hinge joint. If I remove the kneecap and open up the knee joint, we can see that there are a number of soft tissue structures in the knee. The blue structures either side of the knee joint represent the menisci, otherwise known as the shock absorbers, which help to distribute the load in the knee. They're very commonly injured and torn. This is one of the main stabilising ligaments in the knee, the anterior cruciate ligament. A ligament is effectively a piece of string or rope which holds the knee stable, and there are four main stabilising ligaments around the knee joint. The anterior cruciate ligament is the most commonly injured knee ligament which requires surgery. Unfortunately, once it is torn, it usually doesn't heal, and then may leave you with a sloppy or wobbly knee which gives way and can collapse from under you, particularly during sporting activities. Often when you injure your knee, for example on a skiing holiday, you may actually damage three structures. You could damage the medial collateral ligament, which normally heals, the anterior cruciate ligament, and you may tear a cartilage in your knee as well. This may need to be investigated with an MRI scan. Your knee will be swollen and painful for about 6 to 8 weeks after such an injury as this, and during that time I'd recommend that you see a physiotherapist to guide you through initial stages of recovery to reduce the swelling and gently mobilise your knee joint. But if your knee is frequently giving way and you've failed conservative treatment, which is physiotherapy, then I'd recommend that you consider surgical stabilisation. This would decrease the risk of damaging cartilages further and give you a much more stable knee, allowing you to get back to normal. On the morning of your surgery, I'll come and see you and answer any last-minute questions or concerns that you have. I'll place a mark on your leg. You'll then be taken to the operating theatre and normally given a general anaesthetic. The operation takes approximately 1 hour, and during that time we harvest the tendons from your leg to make into the new ligament. The majority of the surgery is performed with keyhole surgery techniques, and at the same time we can address any simple cartilage tears and look throughout the whole knee to make sure that your knee is going to be okay after the surgery. After the surgery, you'll have a bandage on, and you may need to wear a splint or a brace depending on other injuries that you have. It's a little bit painful post-operatively and swollen, but the vast majority of my patients would go home the same day as surgery. For the first 2 weeks I advise that you use crutches, but you are able to put some weight through your knee, and we encourage you to perform gentle mobilisation exercises of your knee joint. Between 2 and 6 weeks after surgery, start to do a bit more. Having seen the physiotherapist, usually between a week and 10 days after surgery, who will guide you through some basic swelling control, mobilisation exercises. I normally don't recommend that you drive a car for 4 to 6 weeks after an anterior cruciate ligament reconstruction. Unless it's your left knee and you have an automatic, then you may be able to drive after 2 weeks. Depends a little bit on what your job is when you're able to go back to work. If you have a sedentary job, you may be able to return to work between 2 and 4 weeks after, but I normally recommend that most people have at least 6 weeks off work after an anterior cruciate ligament reconstruction operation. And if you're a heavy manual worker, I would recommend that you have 3 months off, if possible. For the first 6 weeks, you'll be limited into what you can do, but we'll gradually increase the amount of weight and exercise you're allowed to do with your knee. Broadly speaking, I don't really like you doing any running, jumping, cycling on your own for the first 3 months after an anterior cruciate ligament. The graft is vulnerable for the first 3 months, and it's important that you look after it. After 3 months we can be a bit more aggressive with your rehabilitation, and we start to introduce something called open chain exercises. For example, using a weight machine, running, jumping, using a trampette. Those sort of activities will help to rebuild your muscles and retune your knee to doing more sporting activities. As your rehabilitation progresses, after 5 or 6 months you'll start to do what we call sports-specific training, where your physiotherapist will take you through things that you'll need to do for the sport that you want to do. So for example, if you want to be a footballer, you'll do twisting and turning types of activities. I'm very happy to see you again at any stage if you're concerned about any complications of surgery. If you're worried that you've got blood clot in your leg, bleeding from the wound, or any signs of infection, which are uncommon, if you have any concerns whatsoever, I'd prefer you to contact me. I've done the surgery, I'll look after you afterwards.